There we go. Sorry, I didn't have my notes. Um, we specialize in the full suite of telecom services, conversational AI. We provide our services to a lot of different firms. Um, Healthcare specific, some of our customers are Cedars-Sinai at the top level, which everybody knows. It's a household name. We also provide services to community clinics as well, and everything in between. Um, we also do the Department of Health and Human Services out in the state of Arkansas. So we do a lot of government work as well. So the stuff that we learn as it relates to providing service and supporting these types of customers, they hit, for the most part, all levels from a provider standpoint, as well as DHS as well. We're going to talk about the process in which we go down to actually integrate conversational AI for our customers. We're going to talk about a phased approach, kind of our deployment methodology. Talk about return on investment, the way we break down the actual process into phases. We'll talk about lessons learned, and then we'll open it up for question and answer. So the customer that we're talking about now is Nirvana Healthcare. They are they're a provider. They've got about 12 locations. They're out in New Jersey. They provide services from anything from they do neuro, they do primary care, vein and vascular, behavioral health. A great organization, and they're led by Dr. Salerno. Dr. Salerno is a second-generation provider. He is his family actually started the actual clinic offices out in New Jersey. They're beautiful places. They purchased these old mansions and set them up in the actual community. So it's very very nice setup. So what we do with our conversational AI is when a customer approaches us, first and foremost what we do is we talk about what their goals are. In this scenario, the goals for Dr. Salerno were to actually support their growth. They wanted to support their growth in a way that they were going to leverage technology and not actually hire too many employees. The cost of providing care is going up for them, as well as a lot of other healthcare providers as well. With all the budget cuts going on with Medicaid coming down from the feds, they're getting squeezed. So the cost of providing care is really increasing for them. We also anticipate a lot of the major providers like Cedars are going to receive a whole bunch of very sick people in their emergency departments, right? So it's extremely important to actually provide solutions, reduce the cost of care, while maintaining the level of care and the level of support necessary that patients actually expect. So what we do is we interview the different departments. We have to truly understand exactly what's going on, what the workflows are, and what we can actually automate in the process. Whatever that workflow is, if it's providing a virtual receptionist, if it's providing the scheduling workflow, the pharmacy workflow, medical records request workflow, whatever it is, the first step in the process is calculating out what it's costing to actually provide that workflow, to actually accomplish that task. So we'll actually go through, identify the total cost of that workflow, and then compare it to what we expect it's going to cost when we deploy our conversational AI to actually handle either a portion of it or the complete workflow in total. One of the most important things to understand is what should be, or to decide on, is what should be automated and what shouldn't be automated. Simple virtual receptionist applications that do call routing, that answer FAQ type questions that could actually be found on the website, those are a slam dunk, right? There's no reason why you shouldn't be automating that if you're a provider right now, right? Inbound calls coming in, they're asking about a fax number, they're asking about hours of operation, they're asking about anything that you can actually find on the website, and agentic AI is going to go ahead and they'll crawl that website, continuously check back and answer those questions. Call routing. If you're transferring different departments or different facilities, when somebody calls in and asks for something based on what they ask, you should be able to route that. Very easy to do, right? What's hard to do is the pharmacy workflow. Pharmacy workflow, we spent hours and hours going through that, understanding exactly what the workflow is. It's extremely complicated to actually process those workflows and take over the actual manual process that goes into actually refilling a prescription, canceling a prescription, and going through that. So we usually stay away from that one just because it's very challenging to do. Hopefully at some point in the future we will be able to do that. So deciding on what to automate and what not to automate is extremely important. Setting an ROI goal, right? If there's not going to be some sort of goal that the vendor and the provider are willing to focus on, then you might as well not even get started. If you've been involved in rolling out conversational AI or any sort of AI application, you know that it can turn into just a complete black hole of cost, right? And to unravel that is really, really expensive. So you got to be very careful with that. And then we implement, we tune, and then we measure and monitor. That's the process. Now, my advice, and we've been doing this since 2015, 2016 timeframe. We started in the hospitality market for conversational AI. So my advice is do not discount these steps, right? It's extremely important that you go through these steps and also work with the vendor that's willing to work with you and give you pricing based on these steps as well. What is it that what's going to be phase one? What's going to be phase two? What's the pricing associated with each individual phase? As opposed to a vendor having you commit to a whole run of minutes or interactions that you're stuck with for the next 2 years, whether it's successful or not, right? So what we did was we defined that there was several different opportunities to automate. There was the after-hours patient support, virtual receptionist, appointment reminders via voice. The EHR platform that they use already does SMS outbound appointment reminders. They wanted to do them via voice as well. So we're going to automate that process. And then finally, the scheduling workflow itself. Inbound calls coming in, inbound SMSs coming in. They call in, they get a link with the actual schedule, that whole process. Those are the opportunities that we have to actually automate. So we call these base camps, base camp 1, 2, and then finally you reach the summit, which as it relates to AI, it's probably never going to be done because technology is always continuing. So the nuts and the bolts of it are here. We're targeting, we've rolled out virtual receptionists for them. It's been in place for over a year now. The actual cost that we calced out to actually provide the services that the virtual agent is actually providing now, the monthly cost was about $7,600. They're a relatively small clinic. They do about 6,000 calls per month. These numbers hold true. It doesn't matter how big you are. The state of Arkansas does 6,000 calls per day. The numbers still hold true though, okay? So the monthly cost is about $7,600. Over the course of year 1, year 2, and year 3, the actual savings, and these are actually real figures, we're saving them $61,200 per year for year 1, $67,200 for year 2 and year 3. The reason why the ROI on the year 1 is because there's a setup fee. That's all that is, okay? So this is typical agentic pricing. They actually started in a different model, more of a deterministic type model, but we've converted them to our agentic model, and these are the actual numbers. The after-hours call handling, we've actually, at this point now, what we're doing is we're going to roll out after-hours call handling, which we anticipate the monthly cost right now, it's actually higher than $3,000. They gave me a budget of $3,000. Said, hey, if you can do it for less than this, you're golden, right? So we're just manipulating the virtual agent to actually do after-hours call handling for both emergency and non-emergency calls. Emergency calls, the virtual agent is not going to do any clinical work or determine whether it's an emergency or not. If the caller says it's an emergency, we're going to send it to a third-party company. But reducing the actual cost and the amount of calls that we send to that third-party company for Nirvana is the return on investment is absolutely huge for them. So we anticipate an annual savings of 21,000, and then year 2 and year 3 is going to be about 24,000 is what we anticipate. The actual scheduling workflow, those numbers are actually still being calculated out. We're actually converting Nirvana Healthcare from incumbent cloud PBX and an incumbent contact center provider over to ours. For the last year and a couple months, they've actually been on our virtual agent, and we're routing calls to their cloud PBX provider and their cloud contact center provider. But they've scrapped that, where they're going to go all BluIP now. So we're going to do our cloud PBX. We're going to do NICE CX1. We're an authorized NICE reseller, as well as a WebEx contact center reseller as well. So we're putting them in NICE. And this is the actual process. So the virtual agent that we have in place handles call routing, FAQs, reviews historical contact center dispositions. When we put that in, that's how we actually decided how to actually route the calls. Originally we started out as a deterministic. Now we've converted them to agentic. They'll likely end up in some sort of hybrid model, right? Because the way you actually route calls, that's more deterministic versus FAQs and logic. We're using agentic agents for that. We also roll out what's called hyper support after we turn them up. That's where we actually monitor with them on a regular basis exactly what's going on. And then depending on if adjustments need to be made, we make those recommendations every Friday, and then we put them in place and then monitor from that point on as well. So something for everybody to understand. A quick show of hands, has anybody deployed a conversational AI yet? Has anybody done that yet? Okay. Conversational AI is not a deploy and forget. This is not something that you actually put in place, turn around and walk away and leave it alone. You constantly got to be monitoring, making sure that it's doing the right thing, and monitoring the different dashboards that we offer. If you think you're going to deploy and turn around and walk away, then it's going to be a failure, straight up, right? So it's extremely important to leverage the different dashboards that are available. So these are the metrics that we have for Nirvana Health. They're doing about 6,000 calls per week. The 95% of the calls are going to the virtual agent. 27% of those calls are actually contained, meaning the virtual agent is actually handling those calls. The caller is actually hanging up because virtual agent actually handled the call completely, right? We've got 55% of those calls actually diverted. Diverted actually means that they were transferred to another facility or another department. That's a successful call. So we're running about an 80% success rate. About 20% is no match. Some of those no matches are by design. We don't want the virtual agent to actually do certain things. We want that to actually fail over to the actual call center. Previous to this, all calls were going to the call center, right? Even the calls that a virtual agent should actually handle, including all the transfers. What that creates, and the problem that they had from the start, was something very similar to one of our friends out in Los Angeles brought up. And they said, here's our problem. Our problem is somebody could be coming to an appointment and they're running 15 minutes late. They call in to tell us that they're running 15 minutes late, but they're on hold for 45 minutes. That's the problem you're solving with conversational AI in different departments, right? So if you're operating in a typical conversational AI deployment, if you're operating within like 70% success rate, you're golden. So this is actually very successful, right? And these numbers might fluctuate depending on what conversational AI workflows we actually take on. But that's where we're operating at this point. So we provide all these dashboards, drill down capabilities, recording capabilities to really understand exactly what those interactions are. And then we're able to take all the conversational AI information and incorporate it into NICE CX1 reports so that they have one contact center platform with the reporting engine that pulls in conversational AI metrics, contact center metrics, quality metrics, and we're also able to do cloud PBX metrics as well. They're not subscribing to that. So these are some interesting facts. Um, the typical workday for a full-time employee is you get about 6 hours of work per day. The virtual agent, you get about 11.6 hours per day. Average talk time for an FTE, a live person, is about 90 seconds, where a virtual agent processes things a lot faster. Hourly rate that we calced out, the FTE, is about 30 bucks. That's in New Jersey. That's including payroll taxes and all that. Whereas the virtual agent is about $11.36. And everybody understands conversational AI. They don't take breaks. They don't enroll in, they don't request sick time. They don't, it's a lot safer, if you will. So on this one, the financial savings is about $67,000 annually. It focuses on, delivers patient satisfaction, reduces attrition. When you're calculating out return on investment, there's other costs that you need to consider as well. The technology spend for actually supporting a full-time employee, for the laptop, the licenses, the support, the technicians to support them, fringe benefits, and the like. These are other targets that we have. After hours call routing, these are the numbers here. Again, it's about $3,000 the current cost. We expect to save them about $21,000 to $24,000 annually. And this is what it's going to do. It's going to handle this workflow here, right? Where inbound calls come in after hours, the virtual agent is going to determine what the issue is. Is it an emergency? Is it not a non-emergency? Is it just going to go to voicemail? If it goes to voicemail, then we take that action, send an email to a group. If it's an emergency, then or urgent, then we're actually going to send it to the on-call physician. And then finally, if it's a non-emergency, or if it's from a provider, we're going to send it to the on-call provider, right? So they got calls that are coming in from from a hospital, from a nursing home, and so on and so forth. It's the typical after-hours call routing application. So lessons learned for Nirvana Health is you have to build in redundancy, right? There's got to be failover set up. So we're a provider. We provide all services, so we have that in place. You need to leverage tools that are going to give you the information that you need. So interaction analytics is a component of the contact center platform. They leverage those tools to actually determine what the virtual agent should actually do, what it shouldn't do, right? NICX1, we're a partner of theirs, and they've got some great tools to actually automate and determine exactly what you should actually put in or what you should automate based on call recordings, quality management, and other metrics that the contact center actually gathers. And then they've got a cool application called Actions that will actually determine and generate what you should automate and what you shouldn't automate, or where you can actually improve. So it's pretty sophisticated. And then just continuous improvement. Again, having a single provider like BluIP is very important, not just because I work here, it's because I've been doing this for a very long time. The last thing you want is a multi-vendor solution where people aren't working together. It's a recipe for disaster. So with the single provider, you get tight integration from the virtual agent all the way to the contact center. You have tools that span the total solution. You don't want silos of reporting platforms, because that just creates headaches for everybody, actually all the business analysts. The ability to merge data and technology stacks is very important. These days, you should be able to build a multi-vendor workflow without any issue, without losing data. And then just future products that are coming from those providers. And that's all. Any questions? So the question was, in regards, and very important question, was patient satisfaction metrics, right? So from the start to the end, okay, what they had in place. So with Nirvana, I'll be the first to tell you, what we did for the first 3 months, we actually put that one in, and then it was a combination of Nirvana as well as BluIP, where we put it in, and we left it alone for too long, and we got a lot of complaints. So from that point on, what happened was we had we enrolled them in hypercare, which was no cost, but we started monitoring it completely, and we asked on their side they had to allocate a dedicated project manager. So since then, the patient satisfaction results have been very, very good. They did start out okay, went bad, and then we recovered. That's why it's taken over a year for them to continue on with other stuff. We were humming along, they were doing some acquisitions. One of the challenges that we had was that we were front-ending the actual phone system with our conversational AI. The phone system wasn't ours, it was another vendor's, right? And that was a little bit challenging because there were some routing issues that would actually creep up. There were outages happening on the incumbent's phone system and contact center side, and we were the front end. So there was okay, whose fault is it? That sort of thing. So, but now the patient satisfaction scores are very high, and hence they're rolling out and investing more in the conversational AI. It's a great question, though. Any other questions? Excellent. All right, thanks for joining, everybody. If you guys have any questions or you guys want to see any demonstrations of our agentic AI, we can actually build one for you based on your website in like 5 minutes. We're right up here, BluIP. Again, my name is Joe Hernandez. Thank you so much.